Good morning, ladies and gentlemen. Welcome to the conference again. Today, the topic is on strengths and resilience for disaster management and risk reduction. What NGOs and government can do in collaboration. And I'm Professor Tan Ngo Tiong from the SIM University in Singapore. The conference theme is on resilience and strength in disaster recovery and management, as well as collaboration at the international, national, and local level. What is common in all this are the vital concepts of strengths and resilience. What is important to see in disaster is not just problems and all the crises, the emergencies, but also to look at the positive aspects of how people cope, the resilience in the recovery process, and strengths in the social and community network in dealing with some of these problems. The goal in disaster management and recovery is then to set up policies and practices that will help build resiliency and build the capacity. And of course, then the obverse effect is to decrease the risk and the vulnerability, and as well as the building of strengths and capabilities of the people and the community to recover. Developing strengths and enhancing resilience thus are the key processes for social and community rebuilding. Resilience is the resourcefulness of people, families, and communities, along with the ability to bounce back from calamities. The strengths perspective emphasizes resilience, which includes assessment of positive features and the capabilities for disaster intervention in Singapore. The conference theme is on resilience and strength in disaster recovery and management, as well as collaboration at the international, national, and local level. What is common in all this are the vital concepts of strengths and resilience. What is important to see in disaster is not just problems and all the crises, the emergencies, and the kind of problems that are resulted from disasters, but also to look at the positive aspects of how people cope, the resilience in the recovery process, and strengths in the social and community network in dealing with some of these problems. The goal in disaster management and recovery is then to set up policies and practices that will help build resiliency and build the capacity. And of course, then the obverse effect is to decrease the risk and the vulnerability, and as well as the building of strengths and capabilities of the people and the community to recover. Developing strengths and enhancing resilience thus are the key processes for social and community rebuilding. Resilience is the resourcefulness of people, families, and communities, along with the ability to bounce back from calamities. The strengths perspective emphasizes resilience, which includes assessment of positive features and the capabilities for disaster intervention. What is the strengths approach? It provides a comprehensive, multidimensional perspective to coping with distress and problems. It enhances the potential of the client and the client system to develop effective and functional living. This could also be for a community or a society or even a nation. The emphasis of strength provides a key to reducing vulnerability and enhancing resilience, especially for those in the minority groups, more disadvantaged and vulnerable people. When we have disasters, we find that the government, as well as NGOs and the community, work together for the recovery process. But sometimes the coordination of this is not clear, and therefore there is a need to understand the roles that different parties play. The roles of the local community as well as the government, and the different international bodies that may be involved. And some of the issues that have come up include how can we train staff and volunteers? How can we manage the process? And how can we support the process so that it can be sustained and it can be useful over a longer term recovery process? So the strengths perspective emphasizes strengths of the community, of the people, inherent or developed, and resilience, being able to bounce back, being able to recover in a more effective way. Different people respond to different crises in different ways. Some communities, for example, are able to get back and be able to deal with the problems and they recover. And sometimes the recovery is better than even before. Now, in crisis theory, we understand that recovery process or reorganization depends on the strengths or the coping abilities of the people as well as the community. It also depends on the resources that they have, and also depends on the external environment in terms of the support. All these dimensions of life actually affects disaster, whether the housing can be rebuilt and repairs can be made, whether schools can resume to normality, whether the medical and the transport can be functioning again. But the social aspect, the psychosocial environment is as important. What is the family and the kinship network that supports the person, as well as the community coming together. So all this becomes strengths to help them cope. The strengths approach then is the individual, the family, and the community understanding their situation, understanding their context. It's a belief that they are able to do it and they are able to help them to determine what they want and then to move on to look at strengths. Strengths assessment then is a multi-dimensional one to look at not just the physical resource but also the social network and the psychological and the community aspect. And each community, each person is unique and indigenous in their ways of coping. Some have very strong traditions and culture of community help, like in the Japan earthquake, you see people coming together in helping in a very calm, very collected way, and that's a unique cultural adaptation. But overall, when we are looking at non-government organizations and government organizations, there need to be a certain coordinated framework and integration in the services. So resilience is the resourcefulness and the ability to bounce back. It's the protective factors, and that's opposite of vulnerability, which are the risk factors. And resilience, then the ability to bounce back, is important for personal as well as community recovery. What are the definitions of vulnerability then? Vulnerability is the social, political, and economic forces and practices that channel and distribute disaster risk and susceptibility within a society, and this is, in essence, vulnerability. It is the degree of risk and susceptibility of society, as well as the level of resilience and resistance to disaster. So this too provides a textbook approach to understanding vulnerability, but in the practice, we find that young people, older adults are more easily injured and traumatized. The disabled are not able to run for safety that easily. There are more vulnerability to lower income families, people who are less affluent, and people who have less access. For example, in the New Orleans disaster, Katrina, those who have automobiles, they can drive off, but if you rely on public transportation, there is a crunch in the evacuation process. So the poorer people may not have insurance, and older housing, and fewer recovery resources. For example, they may not be able to pay loans, and then the repairs and all the work, they don't have insurance to cover. So there are vulnerability, and this could be due to personal resources that are lacking, or infrastructural resources such as services of electricity, of buses, of utilities that are not to poorer neighborhood or those affected neighborhood. You find that in floods and in natural disasters, residences that are in vulnerable areas such as low-lying coastal river deltas, like in Myanmar, they are prone to persistent or annual kind of conditions of the climate, and lower delta kind of flooding is common even in parts of India and Bangladesh. What we want to do then is to reduce vulnerability, to see whether in terms of physical safety and ability to cope after a disaster, and then we help people to be more strength-focused in terms of their abilities to deal with the calamities, whether individual, family, or community. Is a belief that people have strength and that there need to be an involvement of the community, the building of the social capital to reduce the vulnerability and increase the resilience. So what we are working on in this approach is really a collaborative approach. There is a dialogue, there is an engagement, there is conversation together with the people who are affected, and generating meaning out of this process, looking at the reality of the situation and looking at possibilities and potential. For example, in the Nias earthquake in Aceh, not a few years ago now, we find that the villagers who were affected, they want to go back to their village. They will need the livelihood of the sea. So they need to have residences near the water, the ocean. But when the rebuilding process comes, they were not consulted, and the residents were built on higher ground and on areas that they cannot have access. So a collaborative process would involve the residents, the people that are affected, and looking at their strength. One good example was that, an example that I heard in Indonesia after the tsunami, was that the people wanted to build their own houses, and they were engaged, they were participating in the whole process, and some who actually were supplied material, and they were asked what kind of help and resources they have. So the material that they were provided with, they were able to build their own houses. So these are possibilities and potentials, and they are actively involved in that collaboration. I would then think that would be a respect for human capacity, the sensitivity to people, and the cultural appropriateness. So empowerment or holistic community intervention involve active choices and control. It also involves the cultural element of providing support and meaning that is useful for these people, and the community response, or spiritual as well as social, is important. Again, in the recent disaster that struck Japan in March 2011, the volunteer center have been placed in all the cities and towns, the prefectures, and the disaster-affected areas by the Council of Social Welfare in Japan. And that provided an avenue whereby people who have been trained, people who are very disciplined, came to the volunteer center and they register, and they were able to be deployed in a systematic way to help the people. So it's people helping people within the community, and that provides that kind of strength and collaboration. Community assets and community orientation would include land building, communication, transportation structures, businesses, buildings, as well as people assets, what their skills, their experiences, the capabilities. They are willing to contribute, and so it is important to organize them. And the community assets include this organized way of voluntary action, faith-based organizations, for example, helping with disaster relief, as well as societal institutions such as schools, hospitals, and the courts.